Thank you, Janella. Have a day and good afternoon. Yesterday, the Department of Public Health and Social Services tested 64 samples. Of those 64 samples, 53 tested negative and 11 tested positive for COVID-19. This is our third highest reported number of cases in one night since the start of this pandemic. This is what we can disclose. Of the 11 positives, 10 have confirmed contacts with two individuals who previously tested positive. These cases are not of the same family, but they come from the same residential cluster in the north. Through initial contact tracing, a total of 25 people were tested from this cluster, and only 10 yielded positive results. Contact tracing and investigation is currently ongoing. The 11th individual is unrelated to this residential cluster, but did have a close contact with a prior confirmed case. All 11 are asymptomatic and remain in isolation. Contrary to rumors, none of these newly confirmed cases are healthcare workers or public safety officers. I know this sudden increase in confirmed cases is alarming and it should be taken seriously. But we have always said that our decisions will be guided not only by one singular occurrence, but by all the data we have. Right now, the data indicates that we should remain in PCOR 2, but approach future decisions cautiously. It's also important to note that contact tracing works. That is how these cases were discovered, and it is a key factor in our ability to sustain PCOR 2. While we remain in PCOR 2, I have decided to delay the opening of dine-in restaurants after meeting with the state surgeon cell. Over the next week, we will gather more data to determine our next course of action. We must continue to remain vigilant by limiting contact with those outside of our host household, wearing our face mask, and washing our hands. We all need to do our part to end this pandemic. Now we'll give it over to Linda for her update.
Yes, as the governor had indicated, there are 11 positive cases, and of the 11 positive cases, we have 6 females and 5 males. The age breakdown for those cases, from the age group of 10 to 19, there are 2 cases. From the age group 20 to 29 years of age, 4. The age group 30 to 39, 1. 40 to 49 years of age, 2. 50 to 59 years of age, 2. In regards, as the governor had indicated, the household contact was 1 and the community contact is 10. And right now we have the residential cluster, and the residents of these individuals all reside at the northern region, and all that were tested were asymptomatic. We want to emphasize that the Department of Public Health continues to launch detailed investigation of all these cases. And as I speak, all my staff are working very diligently to identify all these 11 positive cases and identify other household or close contacts. And as soon as we get all the accurate and detailed information, we will provide that to the media and the whole public so that they will be notified. Again, as we emphasize, the details are very, very important for us to continue our efforts to do our part, be very responsible in all our efforts to contain this virus. And again, I cannot emphasize social distancing, limiting gatherings, and again, being around people no more than 10 at a time. And as the governor had indicated, hand washing and wearing masks. We will continue our efforts to continue contact tracing. And all these, please be assured that all these 11 cases are going to be continually closely monitored by our Department of Public Health, all our nurses, and all our team that will be out there in the field to do this. And again, I want to emphasize that anyone who also may have any symptoms or are in need of seeking some assistance as far as going to the clinics, the public health clinics are all open all the way from Monday to Friday from 8 to 6 o'clock, and also on Saturday up to 6. And so please take advantage of that opportunity to be there. And the private clinics are also available and they are open. We continue to do our testing through our machines. We have 3 machines that are up and running, and we continue to monitor everyone. And thank you.
And we'll turn it over to Dr. Cabrera for his update.
Thank you, Janella. So for my part, it's very short. I just want to reiterate that the governor stating that we will be remaining in PCOR 2 and that we are using a collection of different data sources, but we are very aware of the 11 cases from yesterday, but what we also track are the 5-day rolling averages. So I wanted to share that with everyone. So again, for May 20th, we have 5 new cases, and the 5-day rolling average in this situation would be 2.2. In terms of test positivity rate, from yesterday, it's 7.59, and that includes all the tests from the other labs on the island, including Navy, Farmer Memorial Hospital, and also DLS. And so that makes our 5-day rolling average for test positivity rate 1.52. And in this case, we want to stay below 3%. And again, for new cases, we want to stay below 5. And so this still meets the criteria in terms of the thresholds that we had preset prior to moving into PCOR 2. And that's my part. Thank you.
Can I also add that the Department of Public Health is also going to continue our efforts to continue our testing. We have a whole series of testing to be done. This Friday, we're doing Talafo for all our senior housing units. On Sunday, the 24th, we're also going to congregate housing areas. And on May 26th, we're doing the homeless at the Tamuning Senior Center. May 27th, the Paseo Playground in Aganya for the homeless as well. May 28 at the EPAL main pavilion for the homeless as well, and May 29 at the Dedero Senior Center for the homeless population. And we'll continue, and as we speak, we are also testing all our frontline workers, the Guam Fire Department, the Police Department, the Customs and Quarantine, and of course, also the nurses and the health professionals at the hospital, and eventually our public health facilities. Thank you.
Thank you, Linda. We'll turn it over to the media for some questions. We'll begin with PNC Kevin Kerrigan.
Yes, good afternoon, everyone. This question is for the governor. Given the 11 new positive cases yesterday, have you set any thresholds which, if reached, would prompt the reimposition of some of the social distancing restrictions that have already been lifted, or even a return to PCOR 1?
Yes, thank you, Kevin, for that question, because it will bring us to reminding our people of the 4 criterias that we are going to be using, or we have used, in order to move from PCOR 1 to PCOR 2 to PCOR 3 and to PCOR 4. When we decided to move to PCOR 2, we decided it based on meeting the 4 criteria. Of course, one is sustaining of low case positive cases. Also testing. Do we have the capacity to test? The third is hospital capacity. Do we have the hospital capacity to provide the necessary care, the necessary services to our people who will have to go to the hospital to be treated and also to be taken care of? And we continue to have that hospital capacity. And then 4th is contact tracing. Do we have the capacity to do contact tracing? And we do have that capacity. So those 4 criteria are met when we went from PCOR 1 to PCOR 2. And if you remember, we were very methodical, and we were very scientific and very rational and very logical in what we are going to be monitoring and what we are going to be using to make the decision to go from PCOR 2 to PCOR 3. And so when we went into PCOR 2, we lifted restrictions, and we have been monitoring activities, and we have been monitoring all these 4 criteria. And to this day, these 4 criteria are still being met, and our mobility isn't high. We continue to go below what the baseline is, which shows us that people really aren't out there a lot. They do go out, they do their essential activities and their essential business, but they basically stay at home. So we are not going to go back to PCOR 1, Kevin. We are going to continue our strategy of monitoring, testing, and so forth as we move forward. If you recall, we lifted restrictions on May 10th. And then a week later, May 17th, we lifted some more restrictions. And that is exactly what we wanted to do. And that is exactly what we're doing. And having this contact tracing just shows that we are effective in going back and trying to identify those individuals out there that are positive and maybe are asymptomatic, because the symptomatic ones come to the hospital, the symptomatic ones come to the clinic, and even those cases of symptomatic cases, we don't show hardly any of that. Right now, our hospital census for COVID-19 is 0. No one with COVID-19 symptoms are hospitalized. No one is in ICU. We are we feel really good about that. And we feel still very good that what we are doing is containing the virus. Yes, 11 is alarming. It is very alarming, and it is serious. But I don't think just one set of data for one day is going to be cause for us to go back to PCOR 1. What this, I think, does is it reminds us that we're not out of the woods. It reminds us that we again have to make sure that we do social distancing. We have to make sure that our social contacts are minimized. We have to make sure that we wear our mask to protect not just ourselves, but others. And we have to make sure that we do good hygiene, and we wash our hands, and we use sanitizers. We clean our areas. We know all these have been proven to prevent transmission of the COVID-19 virus. So we are going to continue with what we are doing. We're going to continue monitoring. We're going to look at what the 5-day rolling average is. And if we continue in these numbers of our rolling 5-day average, then we can make decisions about lifting more restrictions. But rest assured that it will not be a decision made without science and without data and without advice from medical experts and from the CDC experts.
Thank you, Governor. My follow-up question, if I could ask Dr. Cabrera, what would it take for you and the Physicians Advisory Group to see in order to change the current status and recommend perhaps additional restrictions be imposed? I mean, what would you have to see for things to go back to the way they were?
Sure. Thank you, Kevin, for that question. So aside from what the governor has already shared, we agree 100% with that sentiment. Now, for what we would look at additionally is, for example, the new cases itself. So we set an initial threshold of 5 cases in one day, but with the key part of that being a 5-day rolling average. So yes, 11 cases, it goes above that threshold, but it's important to look at it as a trend overall. So that's why, again, the 5-day rolling average is important. And in this case, it's only 2.2, so well below 5. If we see that it goes above 5 and it stays above 5 and it's trending above that, then that's one factor to take into consideration. The next part is the test positivity rate. And again, that's 3% is the threshold that we've been setting as a way to, if it goes above that, that will be a red flag. And in this case, from yesterday, it was 7.59, and the 5-day rolling average is 1.52%. So again, well below the 3% part. The other part is that it's important to understand that with this particular increase in number of cases, it's actually a good thing for an entire island that it's actually a cluster, or 10 out of the 11 is a cluster, because clusters are easier to study and control. And that's the key part. If this is 11 positives that are spread around the island, that's a whole different scenario. And that's when we may not even wait for our thresholds to be met before some other decisions have to be made. So that's the key part, I think, in this, in understanding what these 11 cases mean in context. So it's with that I would, that those three main factors is what we will look at before we raise even more red flags. But the key thing to understand again is, even with our histories, that what we showed was the positive cases were showing up to the hospital before we were finding them in the community. We're seeing none of that. So that's an added layer of assurance. The contact tracing team, in fact, the reason why we found these 11 positive is because of the excellent work they are doing, and they're going above and beyond. And also because we have more resources to test is why we're able to find this. So if anything, these positive cases are actually a positive thing overall, because we're finding them early, relatively speaking, compared to in the past. And so we can get this under control in a much quicker and safer fashion, and rather than it can be a small little fire as opposed to a blaze, is what we would compare it to. So I hope that answers your question.
Thank you, Dr. Cabrera.
Thank you, Kevin. Next is Guam Daily Post, John O'Connor.
Thank you. This question is to clarify the procedures for. Can you hear me?
Yes, we can hear you.
Okay. Yes, this question is to clarify the procedures for the quarantine facilities. If the person being quarantined is a non-resident, and this includes people who have been transferred out of PacStar into their current facilities, will that person have to pay for their stay? And if so, what will happen to people who can't afford the quarantine? And will they have to pay at the current rate for each facility?
So if a non-resident who has traveled to Guam comes and they are required to quarantine, they will not be charged. We have not been charging them since I think we started our quarantine services. So no, they will not be charged.
So it's safe to say that GovGuam will cover costs for everyone being quarantined? Regardless
Yes,
of resident?
John, yes, you can write that in your newspaper.
Thank you, Governor. The second question, Governor, we know that there is going to be an oversight hearing today, or at least it's been scheduled. Will your legal counsels, Mr. Hai and Ms. Diaz, show up for the oversight hearing? And if not, can you state why?
My information says that they will be there.
Thank you.
Thank you, John. K57, May Habib.
Hi, good afternoon. This question is for the governor with regards to restaurants reopening. I'd just like to know if you received the draft guidelines today. You were supposed to receive them, to look at them, and what you thought of them, and are they approved? And then also what timeline we're realistically looking at for that dine-in to reopen.
So I did receive them. I did look at them. I had looked at them ahead of time too, before they even gave it to me, because I know of people in the restaurant industry that have been writing the guidelines, and I'm very impressed with the guidelines. I do want to say they do not have to be approved, but they have to be submitted to public health, and public health will then put it up on their website as the guidelines for the restaurant dining in services. As far as timelines, like I said, we will look at the next 5 days of the rolling average of data, and then we'll make a decision at that time. So there will not be any lifting of restrictions this week. We want to really look at our data, get more data, do more, again, expanded testing, and then we'll go from there.
Thank you, Governor. My follow-up question is also to you and switches gears a little bit. And it's regards to the hotels and the quarantining procedure. We understand the hotels are actually currently full and there's actually a little bit of spillover at the Wyndham's sister property. I just wonder if you're thinking of acquiring more hotels as more passengers are sort of anticipated with world restrictions easing a little bit.
Of course, we will, because we are responsible and we want to make sure that we provide all the measures and the resources for our people's safety. And if there's a spillover, we already have some contingency plans to implement should there be the spillover.
Thank you, May. Next is I-94, Chris Barnett.
Half a day, Governor.
Have a day, Chris.
Man, I'm so disappointed because I thought we were all going to go out to dinner next week.
Sorry to disappoint you, Chris, but I'll tell you that's beyond my control.
Right, rain check, Gov. So my first question is for you, Governor. You used what you believe are your special powers under the Health Emergency Powers Act to secure hotels for Guam quarantine and isolation facilities. We FOIA'd payments you ordered to be paid to hotels, and the total so far is $1.7 million. These payments were made without written contracts or even signed contracts. I think some of them you didn't even sign. Can you explain this inconsistency? Why did you use your so-called special powers to pay some vendors, like hotels, but not others, like Tier 2 clinics? And just for background, I know you know in Executive Order 2020-06, you signed that on March 24th. You announced the creation of the COVID-19 Unified Response Effort, or the CURE Action Team, and the direct use of healthcare facilities to provide any and all services necessary to respond to the COVID-19 pandemic. On this same day, you also announced the designation of GMH as the COVID hospital and GRMC as the non-COVID hospital. Additionally, as I'm sure you can recall, you announced that the American Medical Center, FHP, and SDA would be utilized as urgent care facilities, or what is referred to as Tier 2 clinics. Your executive order stated that such participating clinics shall be reimbursed or billed at a rate set forth in Memorandum of Understanding or such other standardized uniform rate as developed by the CURE Action Team. I guess my question is, what's the status of the payments for these clinics? Because they're telling us that they have been forced to retain lawyers and they're not getting paid. We're also hearing that 2 of the clinics that you haven't paid have had to lay off staff and even let go of doctors while they're waiting for payment. So why did you pay for some services with little to no documentation and then not pay the Tier 2 clinics?
So just to set the record straight, Chris, I pay as invoices come. I pay as bills come. And so for the hotels, we are starting to get invoices and bills, and I understand from DOA that they are paying those vendors. As far as the clinics, I have not really received any invoices from the clinics. I know that there is discussions with attorneys about the MOU and the memorandum of agreement, but to this date, I have not seen any invoices from the clinics.
Okay, so you're saying that if they give you the invoices, are you going to use your special powers to pay them right away, or?
I don't need to use special powers to pay them right away. I used my emergency service authority to purchase the services, but the payment as they come, the billing as they come in and the invoices as they come in is a responsibility of the Department of Administration, and that's part of doing business, and that's part of our operations, that's part of our obligations that we are continuously paying as we receive them.
Thank you, Governor. For my follow-up question, I was able to speak with procurement expert attorney John Brown this morning on our multimedia broadcast show containing COVID KUAM News at 6 to 10 weekday mornings. As you know, Attorney Brown is the instructor of basic procurement training at GCC, and he wrote the book on procurement. Literally, he wrote the Guam procurement process primer. But he says that you saying that you have these emergency superpowers under the Emergency Health Act, he says that that's a mischaracterization and a gross misstatement of the law. He also writes that it's not an accident, it's an obvious intention to distort the meaning of law by selectively filtering out any reference to any qualification in the statute, thereby authorizing the creation of a fast track and foregoing of procurement law and its competitive, accountable principles and processes. This deceit remains a continuing misrepresentation because rather than make a new declaration of emergency and correct the problem, your Executive Order 2020-03 has twice been extended by subsequent executive orders on the same terms and under the same alleged authority that you cite in Executive Order 2020-03. Could we just get a reaction to this statement from Attorney Brown?
Sure. Attorneys will have one opinion, and then you talk to another attorney, and they have another opinion, and then you talk to another attorney, and then you have a third opinion. And so everybody has an opinion on how they interpret the law. But when it comes down to the applicability and the reality of why these laws are made, one very, very, very important that a lot of people may not even understand is that when I, as a governor, is confronted with the safety of our community, when I am confronted with a pandemic virus that nobody knows about, that they are very uncertain about this virus, that it's an unprecedented kind of crisis. When I'm confronted with that, of course, I'm going to have laws guide me that allow me to do what I need to do to protect our people. And the law that I was using to guide me was the Public Health Service Emergency Act. And in that provision, it allows me to suspend rules and regulations so that I am able to move personnel. I am able to use monetary resources. I am able to use facilities. I am legally authorized through this law to make purchases of services, real estate, or whatever is needed to protect the safety of our people. And that's what I did. I am not an attorney. I don't have opinions, but I am responsible for applying the tools and measures that I can to save lives and to protect our people. And that's exactly what I did. And as a result of that, we have done very excellent in terms of containing the viruses. Even though we've had this 11, I feel very confident that what we have done, the measures that we've put in, and most importantly, the support of the community is key to that. That is why we are here where we are today, Chris. So, you know this, attorneys argue all the time. I have a house full of attorneys. They argue all the time. And that's their job. Their job is to look at the law, and their job is to interpret the law. Their job is to guide, and their job is to assist people. And so I was advised and assisted by attorneys, and they have said that I have every authority to do what I did in purchasing these services in a very emergent, urgent situation. That's my reaction.
Okay, Gov. I guess I would just counter by saying if you believe that you acted under the authority and the superpowers granted to you in the Health Emergency Powers Act, then why did you change horses in midstream and then go with this other procurement that some have called by the book? So if what you did to procure the hotels, if you think that that was legal and within your authority, why did you change your tune with the procurement of the new facilities?
So both instances, I have acted within my legal authority. The circumstances change as they do. Life is fluid, life is dynamic. That's all I have to say.
Thank you, Governor.
Thank you, Chris. Next is PDN, Jarek Sablon.
Hi, Governor. I wanted to ask you what the latest update is on the stimulus checks. Are they still going out this week? How many? Yeah. Can you hear me, Governor? Oh.
What is it? You want an update on the stimulus checks?
Yeah. Are they still going out this week? Do you have like any
Yeah.
numbers?
Yes, they are. I think Daphne told me that she had sent about maybe 6,000 more to DOA, and they are going to be going out.
Okay. And the next question I had is for Linda. So Linda, some of the people that have been deemed negative have been tested again and have been positive. Are you guys going back to the these negative cases to test them? Is that something that public health is doing?
Yes, if they're testing negative, one of the aspect, as you know, we've had cases in the past with the quarantine. And just a couple weeks ago, we had a negative case in the quarantine and it ended up to be positive. So yes, we keep them, those that are negative, that convert to positive. Of course, if they're in the quarantine, we move them out of the quarantine and move them into the isolation facility where the other COVID positive patients are, so that we don't have cross contamination of that individual that's in the quarantine that is identified now to be positive to infect the other individuals, other travelers that could be in the quarantine. And so, of course, once they're in the COVID positive isolation facility, or they can also home isolate, we will continue to monitor them, making certain that they don't crash and providing them that ability so that if they do crash, they'll be able to get immediate medical help through the Guam Memorial Hospital. So yes, we are identifying those negative cases that convert to positive, and we continue clearing them once they're positive and they finish, their duration. We don't clear them until we now test 2 times so that they can become negative. And 2 negative tests allows them to be able to say that they are now clear and they can go to their home if they're in the isolation facility in the Gulf Guam, or if they're in their home, now they are recovered.
Thank you, Jarek. Next is the point, Nick Delgado.
Good day, everyone. Okay, so Governor, I know you have mentioned in regards to the economic impact relief checks that those are coming in the mail, about 6,000 more in addition to the 10,500, I believe that was announced earlier this week. So that's some very welcome and promising news. But we also understand that there's several checks that have been pretty much sitting and waiting for stamp requisitions. I believe the last number that we've came across was about $35,000 in stamp approvals was needed before that can move forward. Are you aware, or what can you tell me about that process?
So you're probably referring to the Procurement Salapi Ajudan Itauto. Is that what you're referring to, Nick?
My understanding is that the stamp approvals were needed for the EIP, but if it is for the separate program, the local program, please correct me on that and explain, please.
Yes, so we're trying to work out the process. I do know that there are some checks that are ready to be printed and distributed for the Procurement Isalapi, and part of that is the data that we are receiving from public health and through the public assistance. So I'm not too sure what the update is on the stamp approval that we're talking about, but I do know that this morning, my director of DOA told me that there are going to be checks being mailed out.
Okay, so it's pretty much just a learning process, it sounds like, for this program since it's fairly new. So thank you for that. Also, I know that you have mentioned that we are not going to be lifting any restrictions this week, especially with the positive numbers that we found. Dine-in restaurants, that's out. But what about public beaches, parks, gyms, or yoga studios? Is that on the table before the end of the month?
Before the end of the month, that is the consideration. But right now, as I had said before, this whole week period is no lifting of any restrictions, and we're going to wait and see what our data will give us in the next 5 to 6 days.
Okay,
Thank
I
you.
just wanted to get real quick, Governor, your thoughts. The Theodore Roosevelt left Guam this morning. Some positive feedback from the commanders and from the Navy, as well as for them finally getting back on their mission after 2 months being docked here. Your comments?
My comments was I was there to send them off and to wish them well, and it was really a very I thought impressive, a very exciting moment as the sailors are now back in their vessels, and they're all very happy to be back in their vessels. And as they go, as they were sailing out into the waters, I couldn't help but just be very grateful and appreciative for our sailors who go out there and also sacrifice their lives to protect our freedom and our and to protect our peace here, and to make sure that national security is maintained in this part of the world. So I am very thankful for them. And I am also honored that I was part of their contribution to their health and well-being. And
Thank you.
also, on behalf of the people of Guam, I just wanted to thank them also for being very supportive and very welcoming to our sailors.
Thank you.
Thank you, Nick.
Could I just clarify on the EIP checks? I think we are going to be sending out about 6.25 million worth of help and assistance. And that's about 3,300 checks that we'll be distributing out.
Thank you, Governor. Next is Mariana's Business Journal, Wayne Chargaloff.
Half a day, everyone. This question is for Linda. What is the status of the contact tracing app that the Department of Public Health was supposed to roll out? And how much of a difference do you think it would make to the island's contact tracing efforts?
Yes, we have, actually, we're exploring 2 apps. We have the AMOCA already, and we just had the purchase order done. And we had just the other day, the training for all our staff. And so we're rolling it out as quickly as possible, meaning within the next week. This AMOCA application allows us to go into the communication between our staff and the patient that is a COVID positive patient, that we can monitor them by utilizing a virtual system, in other words, an app. And also we're able to ask them how are they doing, and looking at other questions they may have. And this is the same app that we use also with TB patients, that actually we do what is called direct observed therapy for them. They show us the medications they're taking, they take the medication, and we're all seeing everything as they do this. This is the same concept we're going to utilize in terms of monitoring our patients. Now, with the contact tracing, we also have 2 other apps that we're in the midst of going through. The first one is called Safe Places, which is a software that is developed by the Massachusetts Institute of Technology. And this is a device that is going to allow us, for the individual that is COVID positive, that they're going to trace them every place they go, and we will be able to know where they have been. And it has markers that identify throughout where they travel, and it'll have a map of Guam. We've seen it already. And so it's an open source. We can easily download it. It comes with a server that has to be manned, and all this information is entered into the system. And then when someone has been in contact with a person that's COVID positive, it will give you a reaction in your software, whether you have an iPhone or whatever gadget you have, that will tell you that this is a place that you may have interaction with a person who is COVID positive. So it's a very, very powerful device that is now used by thousands of individuals, and it's something that you can just go into and request for it and download it. The thing that about this whole software system is it has to be monitored, and you have to have the fee for continuing the software support in terms of the server support and its continual maintenance. The other area that we're looking at contract tracing is through the UCSF, the University of California at San Francisco, where they have been doing lots of research, and also they are collaborating with us. They're trying to donate a Roger machine, which is a polymerase chain reaction or PCR machine. That's about $300,000. However, we're trying to identify additional funding to increase the test kits so that we can test about 1,000 people a day for over 100 days. So that's about 100,000 people that we can test right away. And so that alone is the testing capability. We also have that capability to do the contract tracing, and that's how we're also going to be collaborating with the University of Guam to assist the Department of Public Health along with the University of Guam for the contract tracing. And so those are the two apps that are the high technology software intervention. And so we're just, we've been communicating back and forth between UCSF and Rob, who is an attorney and who's been part of the governor's economic impact task group. And so we're constantly on, every week identifying other possible resources that we can tap on and continue to collaborate with not only the University of Guam, but also with the public health and UCSF, and also venturing into the possibility of DLS, the Diagnostic Laboratory Services, to be part of our collaboration efforts, and also identifying additional funding that we can use for these test kits. And so that's where we're at this point in time. There's no MOU yet. We're still doing all the preliminary planning. And once that is already intact and all the questions are answered and any other situation that we want to clarify, that's why we do the weekly calls. And we're venturing into the possibility of getting that in place. And again, it's all going to be determined upon the availability of funding to support the additional test kits.
Okay, and just real quick, how do you spell that first app's name, Emocha?
Emocha, yes, EMOCHA. It's like the chocolate, Emocha.
Oh,
I would call
right.
it Emocha because I love chocolates, but it's Emocha, the way you pronounce it.
Right, got it. Okay, thanks. And my second question is for the governor. Right now, unemployment is at more than 19,400. There are a lot of people who are eager to return to work, businesses who want to reopen or open more fully because they're not sure they'll be able to hang on financially as they wait for federal assistance payments and that kind of thing. What would you say to those people who are eager to get back to work or open back up because they're trying to stretch their money and they're not sure if they can make it?
Yes, I think there's also several loan programs that are available for these small businesses, in addition to our GITA small business grant program that we just launched. And so there are financial help out there. I know that there are a lot of businesses that have already taken advantage of the PPP. And I know of a lot of businesses that have continued to employ their employees as a result of the PPPs. And I am also just as excited to get our business going, but I will have to make sure that we are first healthy and in a safe zone where we won't be able, where we will minimize and decrease viral contamination and viral transmission. So I will ask, as Governor of Guam, I will continue to support whatever and however I can to bring back our business community and to help again re-stimulate our economy and to provide the financial means and necessary financial help to these employers so that they can redo their business. It certainly is going to be a very welcoming activity in our island.
Thank you.
Thank you, Wayne. Pacific Island Times, Ethan Perez.
Have a good day and thank you. My first question is for the governor. Does the first gentleman, who happens to be a lawyer, also give you legal advice? Do you consult him about your executive decisions, or does he have any role in terms of your legal matters, pandemic or otherwise?
He has no legal role in my matters. But and you know, I know what kinds of things to discuss with him and what kinds of things to not discuss with him, based on confidentiality, based on privacy, and so forth. And when we do discuss things, he comes from a legal perspective, but he does not give me a legal advice. We talk about it, we discuss it, and so forth. So, in a way, it's good that there is an attorney in our family. And when we do discuss things, it's more like husband and wife kind of discussions. You know, what do you think about this? What do you think about that? Kind of situation.
Okay, thank you. My next question, I would like to switch gears a little bit. There is a concern from the Republican Party about the possibility of abuse in awarding grants under the GEDA program. They urged current administration to be transparent. Will you release the list of people who will be awarded these grants?
If there is no if there's no breach of confidentiality or privacy or whatever, I don't see why we can't release those. It's public. If it's public information, it'll be released. You know, it's using public monies, federal monies. So I don't see why it cannot.
Thank you, Governor, for your time. I have no further questions.
Thank you, Ethan. Next is KOAM Nestor Lecanto.
Good afternoon, Governor and Dr. Cabrera and Linda. I wanted to get back to that cluster of 10. Can you give us more information? Were they part of a larger group gathering? Were they wearing masks there? Was this a neighborhood thing or Mother's Day event? Can you provide us with those sorts of details?
Yes, right now we know it's a residential cluster that is a area where they're all residing. As far as the residents, it's in the Jigo village. I really took the time to call the Jigo mayor to give him my take as far as letting him know that there are all 11 positive cases from his village. And he was very grateful that I made that call as a courtesy call so that he won't be surprised with a press conference. I think it's very good that, you know, we communicate with everyone. And I asked him to please assist as these individuals that are positive are residing and they're doing home isolation. So if they need anything, if they can be of any help to them. And he assured me that he said, Linda, I'm 100% very supportive. And I thanked him very much. And he said, thank you for all that you and the Department of Public Health are doing for our people. And I just wanted to emphasize that we are continuing our residential cluster and the area that we're investigating in great detail. I don't have all the details right now because, as you know, Lester, we just got the test results late yesterday evening. And I am trying to give the staff the opportunity so we can get the accurate information. We don't want to just
but Linda,
give out
sorry,
information. Yes.
Sorry, but were they all part of a gathering, a party, or anything like that?
This right now we're identifying is a residential cluster where I'm talking about. So as we journey through, we will get all those special information as far as who have they been with, where they have gone, and all that. So that's going to be how we're going to do what we call when we have any situation that is linked somehow, that is a commonality among all the 10 individuals. The one that we know for sure is that they reside in the same area. That we are very certain. And as we journey through with more information from them, we'll be able to do more tracing of all the information that is in great detail. And then we'll give that information out as soon as we get that.
Can I add something?
Okay, and the next question.
Dr.
Sorry.
Cabrera wants to add something.
Oh,
Nestor.
I'm sorry.
Yeah,
Sorry, Dr.
sorry.
Cabrera.
It's directly to your question, Nestor. Just to be clear, just to emphasize what Linda had said, and that of course we've been tracking, since we moved to P Corp 2 on Sunday, May 10, and what our mobility has been on the island using a sampling of that. And so in this case, because it's a residential cluster, it's not related to mobility. In fact, because it's where they reside. But rest assured that we have had a slow increase in our mobility on the island. And just for reference, if 100% is considered our baseline, our lowest mobility on the island is 32% back on April 11th. And since May 10, we reached as high as 75%, which is on May 15. And then, but we've mostly been staying in the upper 60s, overall, and that has not correlated necessarily with the cases that we've been seeing. The timeline that we would see in a lag is anywhere from 7 to 12 days, for example, and that's not what we're seeing. And the one thing I want to clarify with everyone is that this mobility data is based on, excuse me, on the iOS devices of users on Guam, and they're so it's the Apple iPhones, and this data is made available on apple.com/COVID-19/mobility. And so this is publicized data, it's anonymized. And right now Google has an Android equivalent of this data, and but Guam is not included into that. So that's why we don't have that data. And so again, it's just a sampling. I wanted to clarify that for everyone, but how it related to this cluster. Thank you.
Thank you. My next question is for the governor. As we speak, the senators are in session. Presumably will discuss, if not today, next week, several bills, I think 3 of them, to pay essential workers double pay. I know you've said in the past that you have been guided by the Attorney General's opinion in not immediately paying the double pay, but would you go on the record and say that you continue to support double pay? And what sort of amendments to the law would you prefer to see in order for you to do so?
I support paying our essential employees who have been out there sacrificing their families, their lives, and their efforts in helping us contain this virus and helping us keep our people safe. I support paying whatever is due them. That's sometimes hard to do because there's different ideas and so forth. But one of the things I was advised is that the current law does not allow me to pay double pay. And as a result of that, because I really wanted to give the employees the compensation that I feel may be fair for them for the risk that they do take. That's why we created the differential pay where they were tiered of 25%, 15%, and 10%. My stand on double pay is this, Nestor, that I would like to see how much it would cost the government of Guam. And I, being fiscally responsible and physically disciplined, need to know what that means in terms of how the impact is in the finances of our government, and am I able to still continue on with the public services that we so need in our community. If I have to pay the double pay and I cannot afford it, but I am by law mandated to pay it, it will be without severe consequences, which could mean, which I don't want to do, furloughing our government employees. So there's a debate here, and there's consideration here is, do we pay double pay for the essential employees and furlough and furlough government employees as a result of having to pay the double pay for the essential employees. That's something that needs to be thoroughly discussed and thoroughly weighed out. What is the consequences of paying double pay to essential employees? How does that impact our government services? How does that impact other employees? So it's not a yes or no answer, Nestor. There's really a lot of complicated moving parts that need to be discussed.
Governor, to the extent that you can't pay it, as you mentioned, would you be in support of compensatory time that they can carry over and cash that in at another time where the government would be able to pay them?
Well, I'll tell you this, Nestor. We had a press conference here with me supporting the bill 359 of Speaker Tina Muñoz Barnes, and it does exactly that in a sense, okay? Because what they worked out, and they worked it out with GFT, and they worked it out with the senators, is that they would pay. It would work into the annual leave compensation benefit. So it would be providing an hour to the dollar, a day of leave to the hour that is worked, up to a cap of 240 hours. But half of that is going to be paid out in annual leave, and half of that would be paid out in over a period of time in cash. That to me was a very, I think, compromising bill. I thought that was very much in consideration of the finances of the government. And when we looked at that, we felt that we could afford that. And so that is a piece of legislation that I continue to support, because it makes financial sense and it makes reasonable sense. And it also provides compensation for the value of the work of our essential employees.
Thank you, Governor.
Thank you, Nestor. Do you want to make some closing remarks?
I just want to say to the people of Guam again that yes, we have seen a blip in the trend that we are seeing as the low coronavirus cases of positive cases. But I think we need to take this and reflect about what we need to do to make sure that we don't see this kind of increase every day. And that basically, again, is that we as a community, we as the people of Guam, each one of us have the obligation and the responsibility to protect our community and to protect our people. And in doing so, I think we need to continue on with, again, the measures that we have been saying since day one of this pandemic, and that is wear a mask, wash your hands, do social distancing. If you don't need to go out, don't go out. Do your essential activities and stay home until we again see numbers that we would like to see, which is down 0, 1, 2, maybe. And so I think this is a call to, again, remind ourselves of what we need to do. And I just want to assure the community that our administration, our public health, our medical doctors, our expertise, our community, every sector of our community is working together to, again, win and fight this pandemic situation. So I just want to say thank you for your cooperation and thank you for your support. Thank you for your patience. I know it's been hard and a big struggle out there, but again, with all our help and working together, we can overcome this crisis. Thank you, and Sejus Masi.